My name is Alan Journet. I live in the Applegate Valley. I'm Professor Emeritus of Southeast Missouri State University. Possibly alone among those testifying today, I come from England. Some years ago, I analyzed the advantages and disadvantages of American citizenship and decided that the positives far outweigh the negatives. However, like many other citizens, I would like to improve some aspects of life here. One of these is healthcare. It might be comforting to think that the U.S. healthcare system is the best in the world. However, there are many myths about healthcare both in the U.S. and in other countries where I have lived. The main myth about healthcare here is that it's the best in the world. If best means those with sufficient funds can buy the best healthcare, or physician income is the highest, or the percent expenditure of GDP on healthcare is the highest, then it is arguably the best. However, if we apply criteria that are more meaningful to most of us, a different picture emerges. Applying such criteria, we find, despite its high costs, the U.S. has among the worst health statistics of all rich nations. On a broad international ranking, we stand 37th in overall performance, below Costa Rica, and 72nd in overall health. There are also many myths surrounding healthcare in nations such as Britain, Canada, Australia, and Costa Rica, where I have lived. The main myth concerns the popularity of these healthcare systems. Government-managed single-payer healthcare is so popular that not even the most conservative governments in any of these countries, think Margaret Thatcher, has ever seriously considered abridging it. The second myth is that patients are not able to visit physicians of their choice. They are. A third is that waiting times for essential treatment, rather than elective treatment, are inordinately long. In contrast, the general pattern is that critical care is received on a timely basis. When I lived in Missouri, I was diagnosed with cancer and given 2 months to live, absent treatment. Thanks to insurance, I didn't have to worry much about the cost of treatment, but I did constantly worry about whether the insurance company would approve doctor-recommended treatment. Luckily, the treatments were approved and worked. A sister-in-law of mine, years earlier, was not so lucky. Her insurance company denied treatment, and she died. We often hear the complaint that we should fear government functionaries making decisions on treatment, as though we are better served having insurance company functionaries make such decisions, employees whose income encourages denying treatment and generating a sizable profit. Healthcare should not be available only if we are employed or are wealthy enough to afford it. Thank you.